That's why I said your doctor, one of the tests they'll do in order to determine a Facet syndrome is they will lean you backwards and twist you. And ooh, if there is pinpoint pain right along the spine, right in what we call the column of the spine where the facets would be, we know that there is a Facet syndrome. We know that when we look at x-ray, if there's a misalignment, we know there's a possible Facet syndrome when there's disc loss. And then when we look at the x-ray and we see thin space, and we look at an MRI now, we can actually look at these joints called facets. We can look at the ligament on the inside, thickens when these start to rub past each other, it thickens, and then you start forming fluid inside there that becomes too much. And based on the leaning back and twisting and that pinpoint pain, based on the thinning of the disc, based on the misalignment on the x-ray and the MRI, we come up with a diagnosis of Facet syndrome. So Facet syndrome is a bone challenge affecting a nerve because we've gone out of alignment and the disc is thinning and you're rubbing these joints together and they're clanging like cymbals. As they clang, they irritate the nerve, they cause an inflammatory process. And so that is how we would use the testing, use the history, use an examination to determine, do you have a Facet syndrome? And yes, Facet syndromes can be helped non-surgically.